The Faculty of Community and Health Sciences at UWC aims to improve healthcare access and outcomes, particularly for underserved and vulnerable communities. These communities often face significant barriers to receiving comprehensive healthcare services. My dream is that no one in these communities goes without the necessary healthcare, and that patients receive seamless, coordinated care that considers their physical, their mental, and their social well-being, and that communities are empowered to take charge of their health, with the health service providers and universities acting as supportive partners. My dream is that universities contribute to a health workforce that is skilled in interprofessional collaboration and passionate about serving vulnerable communities. I dream that the UWC outreach clinic models are scaled up and adapted to other underserved areas, thereby creating a broad network of high-quality interprofessional outreach clinics. This is my faculty's aspirations for their interprofessional outreach clinics, highlighting a comprehensive, community-focused approach to healthcare.
Interprofessional education represents a transformative approach in health professions education. At its core, it brings together students from various health disciplines including nursing, pharmacy, dentistry, and allied health professions to learn with, from, and about each other. This collaborative learning environment is designed to foster a deeper understanding of each profession's role and expertise, breaking down silos that traditionally exist in healthcare education. At the University of the Western Cape, our interprofessional outreach clinics embody this philosophy. These clinics provide a unique platform where students can engage in real-world scenarios, working together to deliver comprehensive care to the community. This hands-on experience is invaluable as it equips students with the skills needed to communicate effectively, respect others' contributions, and collaborate seamlessly in diverse healthcare teams. At UWC, we are proud to be at the forefront of this educational revolution, nurturing the next generation of healthcare professionals who will lead with empathy, collaboration, and excellence.
My name is Safdin, and I'm a social worker for the last 31 years, and I've been involved with community outreaches since my involvement at the university. I am a lecturer as well, and what is so important about these outreaches, I think just the name itself, reaching out to communities that are really shortchanged in terms of vital resources. So to have the opportunity to spend a couple of days in those communities is both beneficial to myself as a social practitioner, but even more importantly for the students. For the students to see what we're teaching them in class, how it really unfolds when they work in communities, when they see, they smell, they taste the community. So for me, community outreaches has been indispensable, but also the other advantage is the fact that they get the chance to work with other disciplines. Just during our engagement today, I saw some of my students bonding very well with nursing students. Some of them have been bonding with the dentistry students, which would never happen on the campus in the class environment. And here they get to appreciate what it is to work with other disciplines. Fortunately, we were sharing the same venue with the students from law. So whenever there was a particular issue that was law related, then we could do a referral in a one-stop approach. So community outreaches, as the word really implies, when we reach out and to make a difference. And all the students have been telling me today, so this is an amazing experience. And maybe just to also conclude, a lot of my students never get around Cape Town's communities. And for many of them today, and even on previous outreaches, many of them say, sir, this is the very first time we see or we come or we got to know this community, a particular community. So community outreaches and this program, offers both benefits to the students, to myself, and to the community that we reach out. Thank you.
The community is really, there's a big need for health and wellness here in Languedoc. We can feel the appreciation, which just makes it so much better and makes our stay so worthwhile.
The significance of interprofessional education and collaborative practice in health education cannot be overstated. As healthcare systems worldwide become increasingly complex, the demand for professionals who can work collaboratively to address multifaceted health issues is greater than ever. By embedding interprofessional education and collaborative practice into our curriculum, we prepare our students to meet these challenges head-on, ensuring they are not only competent in their specific fields, but also adept at working as part of an integrated healthcare team. This approach ultimately leads to better patient outcomes, enhanced professional satisfaction, and a more efficient healthcare system. At the University of the Western Cape, social accountability is at the heart of our mission. We believe that by fostering an environment of collaboration and mutual respect, we are not only shaping the future of healthcare, but also contributing to the well-being of our communities. Our commitment to interprofessional education ensures that our graduates are equipped to make a meaningful impact, delivering holistic, patient-centered care and addressing the diverse needs of our society. Together, we are building a healthier future, one collaboration at a time.